Good afternoon, and welcome to the City Business Healthcare Heroes Awards program. I'm Lisa Blossman, City Business Publisher. We have an exciting program to share, and we appreciate you taking the time to join us. I'd like to thank all of you who have so enthusiastically supported our mission to recognize outstanding healthcare professionals who have given so much and served our community during unprecedented times. Our program is possible thanks to the valued commitment of our sponsors and partners, Ochsner Health and LCMC Health. Joining us now is President and CEO of Ochsner Health, Warner Thomas.
Congratulations and thank you to the 50 professionals honored as 2021 Healthcare Heroes by City Business. This year, we continue to find ourselves living and working through a unique and extremely challenging historical moment. And as we battled our fourth and most significant surge of COVID-19 and endured Hurricane Ida on the 16th anniversary of Hurricane Katrina, it can be difficult to find the daily strength to continue caring for our patients, our families, and our community. But it is during these days when our resilience is tested and our spirits are battered that our purpose gains real clarity. Together, we have brought healthcare services into communities that need it the most. We've collectively vaccinated more than 2.3 million Louisianians and counting. And when faced with a natural disaster that devastated the communities where we work and live, we've stepped up for one another again. You really can't replace the compassion, empathy, humanity, teamwork, and even the joy that comes from the work we do, the work that you do, even in the most difficult times. The nature of a career in healthcare can sometimes make moments of celebration like this difficult. We often don't stop to acknowledge our accomplishments and instead move on to the next patient or the next challenge. My hope for each of you is that you take time to reflect on this recognition and the road that led to this special moment. Your work is more than a job. It's a purpose. And this recognition reflects the incredible impact you make on others. Louisiana has never needed you more, and I am profoundly humbled to join this event and call you my colleagues, collaborators, and our healthcare heroes. For the first responders, nurses, physicians, professionals, and volunteers with us today, thank you for choosing this path and for the continued sacrifices you make to build our community back stronger and healthier than before. What you do matters tremendously, and it is an honor to be part of this special event today. Thank you.
Thank you, Warner, for everything you and Ochsner Health do to help our community. Now, to give a little background on today's event, I'm pleased to introduce City Business Managing Editor, Lance Traweek.
Thank you, Lisa. Started in 2007, Healthcare Heroes recognizes healthcare professionals in the New Orleans area. Today, for our 14th annual event, we are highlighting achievements of first responders, nurses, physicians, professionals, and volunteers. Honorees are selected based on industry achievement and community involvement. We are pleased to announce the 2021 City Business Healthcare Heroes.
In 2001, Chuck Benedict primarily worked in sales, but also was a weekend warrior emergency medical technician. After 9/11, he was inspired to convert his part-time passion into a full-time career. Today, Chuck works as a quality improvement coordinator for Acadian Ambulance Service, where in 2009, he was named Acadian's Paramedic of the Year for exemplary service during his tenure with the company.
When I had my calling for healthcare, I initially actually started out part-time as an EMT, just kind of filling some gaps on weekends or extra money, things like that. I worked full-time for Economical Paper and Janitorial Supplies. I was actually inside sales for them. And I was in the office one day and we're punching in orders and I'm listening to radio broadcasts of September 11, 2001. I'm just listening to all this on the radio and something was just pulling at my heartstrings, and I knew that there was something more I should be doing. Now, I don't know why I didn't go the fire department route, but something was just, and you got to do more than sit here and punch in orders. There's more for you. I actually called Acadian Ambulance up that day and asked them about what steps I needed to take. to make this a full-time career and growing career. And that's what I've been here ever since. So I've been here 20 years now.
Congratulations, Chuck Benedict. Ashley Morrison is a supervisor EMS at West Jefferson Medical Center and has dedicated the entirety of her career to the health and safety of her local community of New Orleans. After finding her passion within the Emergency Medical Services Department at West Jefferson Medical Center, Morrison earned her paramedic certification in 2010. Morrison worked her way through the ranks, becoming a field training officer, an assistant supervisor, and ultimately began working as a field supervisor. She was on the front lines of many crisis situations throughout her career, most recently as an integral part of the local response to the COVID-19 pandemic in New Orleans.
The most rewarding thing about what we do is making a difference in someone's worst experience, or worst time. So when people call 911 for an emergency, it's always at their worst medical event possible, and just be able to make that positive outcome for them, whether it's helping them to get them stable enough to get to the hospital, or truly saving them, or being able to even help the family if it's a family member that's having their worst experience and the family itself there needs some compassion or some, explaining what things are going. It's very rewarding. It's very rewarding to gain somebody's trust in the first 5 seconds of the call. They don't know you. They're calling you for emergency medical help, and for them to trust you and put everything that you have into that moment, it's very rewarding.
Congratulations, Ashley Morrison. Aradni Osborne is the team lead paramedic for East Jefferson General Hospital and has enjoyed a 25-year career of saving lives. Osborne coordinates the night shift for 911 medical emergencies and other medically related calls in Jefferson Parish. She coordinates with fire and police departments and hospitals and educates her team on policies, protocols, procedures, and equipment. She credits her 2 mentors, former colleagues, and deep faith as credits to her success. Congratulations, Aradni Osborne. Anya Burks has dedicated her career to the health field. She spent the last decade at Oxner Health, where she was the director of nursing. She now serves as a national senior director at Ascension, where she is in charge of university relations and assists nurse in shifting from being students to practicing nurses. Burks has had many rewarding moments throughout her career and has enjoyed coalescing with peers, establishing lifelong friendships, and providing help to her community.
I would say that I pride myself in the relationships that I build throughout my career, throughout nursing, throughout just interacting with people. It's really the epitome of what's helped me be successful, what's helped me enjoy my work. It's really all about relationships and building those connections with people. Just take a moment and experience the impact that you are making. You make a difference to pour into yourself as you pour into others, and to just be grateful for the opportunity to be that person who gets to experience life coming into the world and also life leaving the world, and make an impact on your community. It's a privilege, it's a responsibility, and it's really a gift, but it also can be draining to a person. So just remember to also take care of yourself.
Congratulations, Anyel Burks. As a nursing manager for LCMC and East Jefferson General Hospital, Callie Catalanato has been an essential part of the city's recovery through the COVID-19 pandemic. Catalanato worked as a frontline nursing leader for East Jefferson General Hospital's telemetry COVID unit. Throughout the pandemic, Catalanato worked with patients and families to ensure they were able to communicate using phones and email, and devoted time to writing condolence cards to families who lost loved ones.
First and foremost, I enjoy the patient care itself, being at the bedside and helping that patient, and most of the times the family member cope with whatever the new diagnosis is, or help them understand what's going on and how we can fix it, how they can do better going home, patient education. I also enjoy just working with a variety of people from all different areas, whether it be the same nurses on my team or physicians. With being in the nursing manager role, you get to see people from all over the hospital. But that's probably my favorite.
Congratulations, Callie Catalanato. Kiara Dillard joined Ochsner Health in March 2021 as a manager of clinical operations in neuroscience. This Dillard University alumna previously worked at DaVita Kidney Care. In her current role, she helps bring peace of mind to her patients through Ochsner's innovative technology. Dillard credits her professional mentors with providing a lasting influence on her leadership skills and knowledge of the medical arena.
I decided to get in healthcare several years ago, probably during my junior year in high school. I experienced going into the NICU with one of my relatives quite often when she was first born, and that really got me interested in healthcare in general. Throughout the years, the connections with colleagues and professionals, it helped me to realize that everyone typically goes through some of the same challenges and struggles, and just finding those who you can connect with to help you day to day and throughout your career, it really makes a huge difference in where you go and in that guidance and direction.
Congratulations to Kiara Dillard. Charlotte Fauché is the Director of Quality, Training, and Development for Slidell Memorial Hospital and is currently celebrating her 18th year as a registered nurse. During the height of the COVID-19 pandemic in 2020, Fauché served as Interim Chief Nursing Officer, where she wrote a response playbook for the nursing staff and led the hospital's vaccine clinic. She credits her success to her mother and mentor, Christine, who taught her the value of hard work.
In 1990, when I graduated from high school, my mother told me that I was going to be a nurse. And so I went to nursing school. I didn't argue with her. 3/4 of the way through, I decided that probably really wasn't going to be for me and went into the healthcare, restaurant and tourism industry for about 10 years. And then in 2000, I had a life-threatening medical event, which led me to make two promises to God. One was to go back to nursing school and serve people. And the other was to always give blood when the opportunity presented itself. So that's when I went back to nursing school and finished my degree. You don't have to have the title of a leader to be a leader. It's what's truly in your heart. Never hide your light, let your light shine. To whom much is given, much will always be expected.
Congratulations, Charlotte Fauché. Allison Gust is the Assistant Vice President of Clinical and Operational Excellence for LCMC Health. Gust was active in LCMC's COVID-19 response, taking action even before Louisiana had any confirmed cases. After the first case was identified in March, Gust facilitated daily leadership calls to ensure her organization was taking care of their people and patients. Under Gust's leadership, LCMC announced New Orleans' first mass community vaccination site this February, where more than 50,000 people were vaccinated.
The thing that I enjoy most about what I do is looking for problems and coming up with a creative solution to make a patient's care experience either more efficient or just improved from a better experience overall. And so I think one of my favorite things to do is go out and kind of dig into a process and look for a better way or a new way to do something that would make our patients happier and healthier at the same time. So for those who want to get in healthcare in the future, I would say it's always best to follow your gut and follow the reason of why you chose healthcare in the first place. Many of us choose healthcare because of the why behind it. It's our passion to help patients. Never let go of that, and no matter what you're doing or what problem you need to tackle in the future, always go back to your why. It's most important to remember that when caring for our patients and developing new care processes or procedures or implementing something that seems everyday to you, but very out of the extraordinary for them.
Congratulations, Allison Gust. Ruth Kane is an accomplished nursing professional with more than 20 years of leadership experience. She currently serves as Chief Nursing Officer at Tulane Health System. Kane joined Tulane shortly before COVID-19 hit and immediately began refocusing her efforts toward helping New Orleans through the pandemic. In the last few months, she has spearheaded the vaccine process for Tulane Health System employees, often working in the vaccine clinic and encouraging employees to get vaccinated.
The most rewarding aspect of what I do is when I get to actually see the outcome of touching a patient. So it's when the patient's outcome is positive, they get to go home healthy with their families. The other aspect that I really enjoy as well is just the impact that I can have on the healthcare team itself. So really being able to make sure that the nurses have what they need to be able to do their job. When they get to leave the work at the end of the day and feel like they've accomplished something, I feel like I've accomplished something as well, because we've put good processes in place. We've helped support them through different programs. We know that they're able to provide the best care to our patients, which in turn then provides the great outcomes for our patients. And for me, that's very fulfilling.
Congratulations, Ruth Kane. Erica Lambert is a nurse and community testing and vaccine coordinator for Children's Hospital New Orleans. To reach high-risk populations who face healthcare barriers, Lambert and her team at Children's Hospital reached out to local school leaders to establish testing protocols and test students on site. The staff also set up drive-through testing for groups as large as 200 or more students and teachers. Lambert is also currently pursuing a master's degree in healthcare administration as a way to build on the skills honed in her various roles and make a broader impact.
My advice for future healthcare workers would be to follow your own inner voice and let that guide you in the decisions you make throughout your entire career, and trust your inner voice and do what's right. I'd like to thank CityBusiness for putting on this event, especially despite the circumstances of a pandemic. I truly believe it's an example of our ability to come together as a community despite what's going on in the world, and really support each other. And I know for being a healthcare worker, I really appreciate your support and your recognition of healthcare workers during this time. So thank you for all the effort you did or put forth toward this event.
Congratulations, Erica Lambert.
What an incredible group of heroes. Before we continue with the rest of the honorees, we have an important message from our partner. Joining us is Dr. Jeffrey Elder, Medical Director for Emergency Management at LCMC Health.
I'm proud to be part of the LCMC Health family, one of the 20 honorees from our health system, recognized this year as a CityBusiness Healthcare Hero, although many more deserving of this honor. At LCMC Health, we believe our employees, our physicians, our volunteers are extraordinary for the quality and compassion they deliver every day to our patients. This recognition speaks to our dedication to the patients and the communities that we serve every day. Our impact to our community, not only as an employer of the more than 12,000 team members, but also the services that we provide. Our Be in That Number campaign at the Convention Center vaccinated thousands of people against COVID-19. It created a comfortable and positive healthcare experience for our community, truly celebrating our culture, delivering the little extras and healthcare with a heart. And recently, Forbes listed LCMC Health as the best healthcare employer in the state. As part of that, we're growing our nursing workforce through a partnership with Chamberlain University and our Called to Care Scholars program. We've been here for our community during every surge of COVID, including this last fourth surge of COVID-19. Once again, allocating supplies, resources, and most importantly, people to care for our patients where they're needed most. And following Hurricane Ida, LCMC Health established recovery and relief programs to support our team members who were greatly affected. LCMC Health takes every day and makes it extraordinary. And to all of the healthcare heroes and all of the honorees today, congratulations and thanks for being here.
Thank you, Dr. Elder and LCMC Health for everything you do to help our community. Now, back to the Healthcare Heroes honorees.
Shivappa Maranabasari was a nurse for 15 years in India before being recruited by Kaizen Technologies to work as an RN at Toro. Every day as a nurse presents new challenges for Maranabasari. However, one of the things he's most proud of is seeing COVID-19 patients who had respiratory difficulties survive and go home after the hospital's timely assessment and intervention. Congratulations, Shivappa Maranabasari. As the Chief Nursing Officer and Chief Operating Officer of New Orleans East Hospital, with 28 years as a registered nurse, Courtney C.J. Marbley has provided direction, leadership, and management for nursing and patient services throughout the pandemic. He set up testing, vaccine sites, and worked with community partners to ensure vulnerable and minority populations had access to care. Marbley also serves as Vice President of the New Orleans Black Nurses Association.
Growing up as a kid, I was exposed to healthcare. My mom was a licensed practical nurse. My dad was a Navy corpsman. So I had healthcare around me, saw the great work they were doing, and knew I wanted to be something in healthcare to really impact the health of communities. Didn't know exactly what until I got to college. The most rewarding aspect of my job is interacting with patients in the community. So whenever the day-to-day work of the office gets to be a grind, I go out and start talking to patients, go out to one of our community activities, and see the difference we're making in the community here in New Orleans East and around the area and around New Orleans, and really see how that is changing people's lives. So that's what I enjoy the most.
Congratulations, CJ Marbley. As the leader of more than 60 ICU nurses at University Medical Center, Rachel Nickel manages with compassion, empathy, and a passion for critical care. She serves as the chair of the hospital's Standards and Practice Council, which drives nursing policies. Nickel, a New Orleans native, studied at Johns Hopkins University and specialized in intensive care unit care and cardiac ICU care before returning to the city. She was a Nurse Leader Fellow in 2020 and is the treasurer of the New Orleans chapter of the American Association of Critical Care Nurses.
Being able to support the staff that I have, being able to guide and mentor them, and create process change. So that's been one of the most rewarding things. One of the things that I would advise people is to just be open, adaptable. I would say one of the things, being open to change has been one of the things I've learned this last year and a half, in how rewarding and successful you can be in supporting patients, staff members, and really trying to create a team. So thinking outside of the box and being flexible and open to change and new ideas is something that I would advise.
Congratulations, Rachel Nickel. Derek O'Neill is the Magnet Program Director at University Medical Center, where he is in charge of quality control and implementing best practices. In his role, he reaches out to other facilities to understand the problems they face and how they resolve their issues, so he can learn from them and follow suit. O'Neill views a healthcare hero as someone who is engaged with wanting to affect change and contribute to continuous improvements.
What I enjoy most about what I do is just working with my team, just trying to make a difference, actually looking and working with my patients, seeing them get better. I really like to see that progress of being sick and ultimately working with them to get well and seeing them go home in a much better state.
Congratulations, Derek B. O'Neill. Melissa Pennebaker is a palliative care nurse practitioner at Toro Infirmary. Her own experiences with loss and grief at an early age have helped to inspire the patience and empathy she brings to her work with the families of critically ill patients. Pennebaker's goal and philosophy as a palliative care NP is to maintain someone's quality of life as best we can so they can live out their days in comfort. Congratulations, Melissa Pennebaker. Sherry Rivera, instructor of clinical nursing for the Nurse Practitioner program at LSU Health Sciences Center, is an exemplary faculty member who serves as a leader in multiple capacities, including chairing committees and leading a community COVID-19 vaccine clinic. Rivera was the lead organizer of the LSU HSC COVID Immunization Clinic and continued to teach her courses at LSU School of Nursing during that time. Rivera has shown the highest integrity and stewardship with monitoring the number of shots drawn per day and would regularly stay late to get all shots administered.
So I actually decided to enter into healthcare when I was
17 years old. I was trying to choose a path for college, and I was debating between biology and nursing. I actually chose nursing, and as things have gone along, I've also had the opportunity to teach as well in nursing. So I got the best of both worlds, I feel. I would encourage people that are considering nursing to go for it. Nursing is a wonderful career. There's many opportunities and so many options that you can choose from. You know, especially with COVID, we have seen the need for nurses, and we desperately need more nurses. So I would encourage people to consider that as an option.
Congratulations, Sherry L. Rivera. Erica Rogers is a nurse at Gifted Healthcare. She began her career at MD Anderson Cancer Center, where she became close to a patient who inspired her to launch the Braveheart Foundation. The foundation serves as a peer support group for cancer patients and organizes medical mission trips to Uganda. The organization also has held COVID-19 vaccination events. In an effort to go beyond the walls of the hospital, Rogers participated in Governor John Bell Edwards' Health Equity Task Force, where she provided best practices for mitigating the spread of COVID-19 throughout the state. Congratulations, Erica Rogers.
Some of the most rewarding aspects of being a healthcare professional, a nurse for me, is the fact that I can go outside of the walls of the hospital and still be able to give the same love, compassion, and care that I give inside of the hospital. Some of the aspects that I enjoy most is the community outreach aspect. That has allowed me to even go abroad and extend my healthcare skills there. And while here, whether it be disaster preparedness, whether it be community outreach events with COVID-19 awareness, or whether it just be educational opportunities to teach my community about mitigating factors with COVID-19, it's all still a part of care and nursing, and that's what I get most out of it. Some advice that I would give to future healthcare professionals is always do everything that you do with your heart. Let your purpose guide you, and the career elements will follow.
Congratulations, Erica Rogers. Carrie Wilcox is a manager at the Emergency Department of University Medical Center, New Orleans. She was the first nurse in her department to become nationally certified as a trauma-certified registered nurse and is currently working her way through an MBA program. During the COVID-19 pandemic, Wilcox has been instrumental in helping the hospital separate patients safely and assign treatment areas. She also worked with administration officials to free up staff and accommodate the needs of the Ernest N. Morial Convention Center, in addition to staffing citywide testing sites and facilitating nursing home testing schedules.
I've been a nurse now for almost 17 years. Both of my parents are in healthcare. My mom worked in the lab. My dad's a pharmacist. So I was always around them helping other people. And I also, it's funny, but I'm a 90s child too. So I grew up watching the show ER, and that's where my passion became for going into the emergency department. If I could give advice to a future healthcare professional, the first thing I would say is do it. It's the most rewarding job you'll ever do. It's very difficult, it's time consuming, but it is a passion. You have to want to do it. You go home and take your job home with you, but at the end of the day, you love it. Everything about helping other people, especially in the emergency department. We get to save lives daily, especially here in New Orleans.
Congratulations, Carrie Wilcox. Dr. Jennifer Avegno is the director of the New Orleans Health Department and an emergency room doctor with a master's degree in sociology. She has been on the front lines of the COVID-19 pandemic and at city news conferences giving updates. She's actively recording her own COVID-19 data and identifying trends, which she shares with city and state leaders to help shape policies. Avegno also helps spearhead the city's community-based COVID-19 federal government testing site and sits on the boards for 504 HealthNet Louisiana Public Health Institute, and New Orleans East Hospital.
I think the best advice I could give is to see healthcare as a vocation, a true vocation, not just a job. I think you really have to have a passion to serve. You have to expect to go above and beyond. You have to expect to ask more of yourself, to give over and above what maybe other people give in their daily job. And when you do that, the dividends are incredible. It really is one of the few professions left that is a true service profession, and you are putting others above your own needs or functions at that point. Asking what am I doing for others is really the path to long-term happiness. It's not easy at all, but it's the path to long-term happiness and a feeling of accomplishment, a feeling that you really have made a difference. So understand yourself and just ask yourself to give more, because I think you'll be very glad you do.
Congratulations, Jennifer Avegno. Dr. Catherine Baumgarten is the Medical Director of Infection Prevention and Control at Ochsner Health. As an infectious disease specialist, paying attention to outbreaks like COVID-19 is part of her job. Throughout the challenging months of the pandemic, Baumgarten made sure staff had enough personal protective equipment to treat patients safely. Today, she urges business leaders to keep in mind the importance of good health for the region's economy.
Most of what I do in my day-to-day, I absolutely love. People ask me all the time because my job right now depends and is basically all about COVID. And part of what I love is being able to see people and interact with my patients and hope that we can make a difference in their care and in their lives. Right now, it's all about vaccination and prevention of COVID. And so a lot of what I do is talk to people, talk to patients, talk to the community about prevention and vaccinations, which I really love.
Congratulations, Catherine Baumgarten. As an assistant professor of orthopedic surgery and medical director at Tulane Hypermobility and Ehlers-Danlos Clinic, Dr. Jacques Courceau deals with everything from sports concussions to neck and back pain. In graduate school, Courceau co-founded a nonprofit weight loss program named Don't Wait to Lose, which contributed to hundreds of New Orleans shedding pounds. He is certified by the American Board of Physical Medicine and Rehabilitation, ABPMR, and is a member of several top-tier sports medicine organizations. Courceau also serves as an assistant professor at Tulane University School of Medicine.
While I am a sports medicine doctor and do care about muscles, ligaments, tendons, and bones, the cardiovascular system may also be involved in what's going on. The neurological system may also be involved in what's going on. So it really is a lot of fun to be somewhat of an investigator and find nuances or kinks in these systems, optimize them, and just help people get much better to get back to do what they want to do. An additional benefit to my particular practice is that I do ultrasound guided injections. So to be able to see the problem with ultrasound in a muscle, for example, inject it, and people get up and say, wow, like instant relief, that is so rewarding, and that just never gets old to me. My advice would be to learn as much as you can along the way. Lao Tzu had a quote that says that the journey of 1,000 miles starts with a single step. And really, my mistake in growing up and wanting to be a doctor was I was always wanting to hurry up and be a doctor. The true fun of all this is the journey. It's what you're learning in high school, and undergrad, all the things you learn in med school. Even if it's a specialty that you're not particularly interested in, learn as much as you can about it, because at some point in life, you may need to learn certain things about that system that are relevant to that person sitting in front of you. So just, there's really no rush. Enjoy every minute of it. Every person that you see that's asking for your help is truly a privilege.
Congratulations, Jacques Courceau. Joshua L. Denson attended Tulane Medical School and was a fellow in pulmonary and critical care. He is now the director of medical critical care at Tulane University School of Medicine, where he coordinates critical care, intensive care unit, and COVID-19 cases. Denson is also an assistant professor of medicine, teaching the next generation of doctors. Additionally, he sits on the board of the Jewish Community Center and the Beichel Clinic Foundation. a medical nonprofit that does work in underserved areas around the world.
Before I decided I wanted to be an ICU doctor, I grew up, my father's a physician, and so I pretty much have grown up in the hospital my entire life from the age of 2, sleeping at the hospital with him when he would moonlight. And so it's been always part of my family life, very much integrated into our life. You know, I think whenever I find things are tough, I tend to come back a lot to the learners and to the simple things of medicine. So I really like teaching people how to take care of other patients and how to go about their day in the hospital, in the clinic. And I find that to be the most rewarding thing. So always, whenever things get stressed and you're not sure which way things are going, to always try to remember that why you were there in the first place. And then second, that there are people that you're providing an example for and trying to show them the right way.
Congratulations, Joshua L. Denson. Chancellor Donald is an assistant professor at Tulane School of Medicine and director of cancer management services for Tulane at University Medical Center, New Orleans. Donald views medicine as an act of service and loves helping others through his work. He seeks to honestly examine disparities, address them, and find solutions. For him, being a healthcare hero means demonstrating excellence, integrity, and authenticity in the spaces he occupies.
In regards to what I find to be most rewarding in this career in hematology and medical oncology, is that I get to meet a wide variety of individuals, particularly at tough spots in their lives. And in those moments, I get to see tremendous grace, even as they face loss. And I use those lessons to incorporate how I behave within my life and to have gratitude with the interactions that I have with different people. I am exceedingly grateful for that. And when I think of the community as a whole, especially New Orleans, I'm so pleased to have a part in that. I feel that we all have a role to play, and we all have a given skill set in which we can use to improve humanity. And it is with this tool set that I really enjoy being a part of the community. And I am able to see what I get back from the interactions with different people.
Congratulations, Chancellor Donald. Dr. John Dwyer is the Medical Director of Infection Control for the Tulane Medical Center. During the COVID crisis, Dwyer launched and oversaw a team of medical students who solicited, collected, inventoried, and distributed PPE donations to New Orleans hospitals. Dwyer is also an assistant professor in Tulane's Infectious Disease Department and currently serves in leadership roles at various medical centers and clinics. Dwyer has a strong interest in clinical tropical medicine and successfully completed the Gorgas Diploma course in clinical tropical medicine in Lima, Peru in 2019. Congratulations, John Dwyer. Dr. Jeffrey Elder is the Medical Director for Emergency Management at LCMC Health and ER physician at University Medical Center. He has been on the front lines throughout the COVID-19 pandemic and served as the key spokesperson for LCMC Health. He is also one of the key leaders in LCMC Health's Incident Command Center, coordinating logistics in care and PPE for the system's 6 hospitals throughout the health crisis. Elder also serves as the chair of the Louisiana Emergency Medical Services Certification Commission and teaches classes and certifications to EMS personnel.
I would remind people going into healthcare now that it's all about the basics. Certainly the past year and a half has been there's been a lot of turmoil in healthcare. There's a lot going on. We've been under a lot of stress with the pandemic. But I think people just need to remember that it's really all about doing the basics well. And if we do the direct patient care really well all the time, that's how we make the biggest differences in our patients. And that's how we improve outcomes. As you move through your career and you go from, that initial, learning about healthcare and becoming a clinician into all the other decisions that have to happen, just remember that it all comes back down to, is this going to improve the care of the patient?
Congratulations, Dr. Jeffrey Elder, on being inducted into the Hall of Fame. Dr. Keith Ferdinand has spent his career treating patients across all socioeconomic backgrounds. focusing on underserved communities in New Orleans. In the 1980s, Ferdinand and his wife opened the Heartbeats Life Center in the 9th Ward to address the heart health needs of the underserved community. Today, Ferdinand continues his outreach through the Healthy Heart Community Prevention Project, sits on the board of the Silverback Society, and teaches the next generation of cardiologists at Tulane University School of Medicine.
For the future, we've become more technical and more based on electronic health records. I don't think that that's a problem per se, but for young clinicians, whether they be doctors, nurse practitioners, pharmacists, or whomever, it's most important to recognize that the power we have is the power to help life create itself. We as physicians and other clinicians don't create life. We help people in their journey through life. So rather than spending all of your time with electronic health records and the other tools that we have now on the internet and the mobile devices, don't forget direct patient interaction. The ability to help someone help themselves is the most important component of being a hero.
Congratulations, Dr. Keith Ferdinand. Dr. Leron Finger oversees safety and quality initiatives for Children's Hospital, including infection prevention programs. Early in the pandemic, Finger helped develop and implement COVID-19 safety protocols for the hospital and its patients. He also worked with the state's Department of Education and Office of Public Health to help craft guidelines for holding in-person classes.
I first thought about entering a career in healthcare when I was an undergraduate in college, and I thought, wow, I don't like jobs where you sit in an office all day. So I decided to enter medicine, where I got to interact with people on a daily basis. Funny thing is now, I sit in an office for a large portion of my day as I help manage the daily operations of a large hospital within a health system. Being a part of the leadership team for the largest freestanding children's hospital in the state of Louisiana allows me to interact with people who all share my passion for advancing healthcare for children. It's an unbelievable mission and one with which everyone here is fully invested.
Congratulations, Dr. Leron Finger. Dr. Jason Halperin's dedication to the field of HIV has resulted in changes to the national standard of care. Halperin, the infectious disease clinical lead at Crescent Care, spearheaded the Rapid Start program that allows anyone who has been newly diagnosed with HIV to be seen that same day and begin treatment immediately. The Rapid Start model is now the standard of care nationwide. Halperin also remains involved with RIP Medical Debt, a nonprofit that raises donations to pay for outstanding medical bills.
I grew up in Florida, and we had family friends who passed away from HIV, and that was a very powerful experience to me. And as I grew up, there was a desire really to confront the HIV pandemic, to end the stigma that continued to exist against HIV. And to me, the best way for me to do that was to enter the field of medicine. I never thought I would be in this position, that I get to keep people alive with one pill once a day, incredibly well tolerated. And now we also have medications that prevent HIV. I could even see the end of the HIV epidemic in my lifetime and in my time in practice. And I think that can be attainable in the near future. We have the tools to do that. So it's really exciting for me to be doing the work that I'm doing right now.
Congratulations, Dr. Jason Halperin. Dr. Sunil Neil Jolly joined Louisiana Pain Specialists in 2016 during a wave of the opioid epidemic. He built a strategy in reducing patients' reliance on pain medication by incorporating unique minimally invasive treatments and alternative non-opioid medication options. Jolly joined New Orleans East Hospital as the medical director of pain management and is the medical director at Crescent View Surgery Center, in addition to continuing working at Louisiana Pain Specialists today. Jolly also developed a SAFE initiative that outlines best practices for treating chronic pain.
I wanted to enter my career in healthcare. Actually, it happened during medical school. And if I look back at that time frame, I knew I wanted to be a physician. I knew I wanted to integrate myself in the community, especially down here in New Orleans. But how do you get involved in a patient's life on a very intimate level? I felt that pain management would be an excellent route because pain literally affects just about every person on this planet at some point in their life. And because of that, I think coming up with unique therapies, unique modalities to treat pain, not just efficiently, but safely, it resonated a lot with me during my career in medicine thus far, specifically in medical school when I encountered every specialty, but every specialty essentially had pain management involved in it on some level. Aside from that, I just wanted to add one more thing is that in my training, which spanned 13 years across institutions like University of Texas, Yale, Wake Forest, all of that brought me right back down here to New Orleans because healthcare down here, I truly feel is unmatched. And it all comes back to serving the community and how we as healthcare providers communicate to one another.
Congratulations, Dr. Neil Jolly. Dr. Ravi Kanagala, an electrophysiologist at Lakeview Regional Medical Center, starts each morning by completing rounds with the hospital patients and then practicing in the hospital clinic. He conducts procedures in the afternoon and also does satellite clinics in various small towns twice a week. He not only finds treating ill patients a gratifying part of his job, he likes to also provide preventative care through proper care and lifestyle changes. Congratulations, Dr. Ravi Kanagala. Dr. Michelle Longo is an assistant professor of neurology at Tulane University School of Medicine. She knew she wanted to be a neurologist since grade school when a neurologist treated her chronic migraines and became her hero. Now, Longo specializes in migraine relief, as well as patients suffering from long COVID, lingering symptoms after contracting the virus, and is supported by the National Institutes of Health for the clinic.
The privilege to be able to be on someone's health journey when they're having difficulties and to listen to their stories and to work together with the patient to try to help to minimize their suffering. It's a great privilege and it's an honor, and that personal relationship that needs to develop with each patient, I think, to best understand what their needs are is the best part of the job. My advice to anyone who has the privilege of working with people that are struggling with any neurologic issues or any medical issues is to first listen. We have lots to say, lots of good advice. We have lots of medications and things that we can do to help people along the way. But I think that the ability to listen helps us to most understand what it is that the patient needs from us and what they're looking for.
Congratulations, Dr. Michelle Longo. Dr. Andrew Pisa began his career in emergency medicine in 2012 at Slidell Memorial Hospital and now serves as the hospital's emergency medicine director. During the COVID pandemic, Pisa spearheaded policies to protect staff and streamline efficiency, including procuring a portable trailer to create an area for patients to be examined by a provider and receive a COVID test in a separate location from the emergency department. He also helped start a campaign for community members to sew cloth masks for the hospital. Congratulations, Dr. Andrew Pisa. Dr. Candace Robinson is the Chief Medical Officer of New Orleans East Hospital, where she ensures quality patient care throughout the facility. As medical director, she also oversees all the physicians and advanced practice providers working in the emergency room. Despite New Orleans East lacking the resources some other area hospitals have, Robinson utilizes the relationship with LCMC Health to provide necessary specialty services to local patients.
I made the decision that I wanted to enter into healthcare after participating in a summer program. I was able to work at a hospital during the summer called Charity Hospital. I had the opportunity to participate in taking care of patients in the emergency department, and ever since then I was hooked. I enjoyed seeing people come in, they had their emergent conditions. I watched what the physicians did. I watched what the nurses did to take care of the patients. And I thought that that was something cool that I would want to do when I grew up. So I went to college and then I decided to go to medical school. And even though I did consider other fields in medicine, I ultimately ended up going back to the emergency department, which is where I currently still work. I enjoy it every day. And even though I work administratively, I still work clinically and enjoy both aspects of taking care of patients.
Congratulations, Dr. Candace Robinson. Dr. Jules Walters opened his private practice, the Modern Plastic Surgery and Med Spa, to fulfill his mission of offering the latest cosmetic surgical treatments in a warm, modern, relaxing environment. Walters helped pass a law that ensures insurance companies cover more costs during a mastectomy and reconstructive surgery, and developed an advancement in post-mastectomy breast reconstruction. In addition, Walters is a member of many societies, support groups, and mission trips. Congratulations, Dr. Jules Walters. Dr. Rohan Valvakar is deeply involved in the ENT specialty. He is a clinical professor with the Department of Otolaryngology, Head Neck Surgery at LSU Health Sciences Center, and a director of salivary endoscopy services. A few years ago, he founded Endorse, an app that allows organizations to communicate praise and acknowledge peers in busy environments. As one of the co-directors of Medical Innovation Design Labs, he's heralded innovations for the treatment of salivary gland disorders and COVID-19. He and his department have had medical firsts locally, nationally, and globally.
The most important thing is, we take this oath called the Hippocratic Oath, when we get our medical degrees. And I would say that stay true to that oath. The most important thing in medicine is focusing on, doing good first. Making sure that you don't harm patients. There's a lot of distractions nowadays with social media, with monetary gains associated with the medical professional or the medical business. It's always good to be successful in your career, but I think one of the things that you always have to remember that the reason why you're in medicine is to heal other people. I think if you stay true to that, everything else solves itself.
Congratulations, Dr. Rohan Valvakar. Stephen Baldwin is the Chief Operating Officer of Toro and Incident Commander for the hospital's emergency management team. At the height of the COVID-19 pandemic last year, he oversaw the hospital's transformation of 140 rooms into negative pressure rooms for COVID-19 positive patients, helped the lab acquire platforms to perform more than 15,000 tests, and drove PPE supplies to the residential retirement community of Woldenberg Village. Baldwin spent 14 years working at Tulane Medical Center, HCA, including 9 years in senior management roles. Congratulations, Stephen Baldwin. In his role as the President and Chief Executive Officer of Lamico, Dr. Michael Connerly delivers comfortability to physicians, healthcare providers, hospitals, and clinical facilities through the largest medical professional liability insurance carrier in Louisiana. Throughout the COVID-19 pandemic, Connerly spearheaded a resource webpage for insured patients, led the return of premiums to assist those whose practices were closed or reduced, and worked with Lamico Risk Management to continue insurance coverage.
The mission that we have to support our healthcare heroes that are on the front line is very satisfying as we work to support them as they fulfill the healthcare needs of our patients. One of the most satisfying things that we do is we've made a very big initiative of patient safety within our company. We've gone to the point of forming a subsidiary company named Medical Interactive that is a risk management education piece that focuses on trying to improve patient safety. And through doing that, we think that we help support all of the patients in our state and in our region.
Congratulations, Dr. Michael Connerly. Hunter Hansen has been a medical psychologist at DePaul Community Health Centers for nearly 7 years. As a result of his efforts to move appointments to telehealth platforms, the health centers saw a substantial drop in no-shows for behavioral health patients compared to pre-pandemic appointments. Hansen provides mental health training and advocacy support for the Collaborative Family Health Association. He also works with the Christian Community Health Fellowship and the Governor's Commission on Youth and Juvenile Justice.
I think it's important to do a lot of research before you go into a training program for healthcare, any of the health, mental health or other aspects of medical providers. There's a lot of options these days about where you can go and how you can pay for it. So I think really researching it like you would an investment. We don't always do that with, careers, especially when you're younger. You get an idea, and you may just go for the first thing that fits with that idea. But there's a lot of ways to pay for school. There's a lot of ways, a lot of training programs.
Congratulations, Michael Hunter Hansen. Julie Henderson is the Executive Assistant and Chief Advocacy Leader at DePaul Community Health Centers. She has been her organization's Chief Advocacy Leader for about half of her decade with the company, supporting policies that benefit the uninsured and underinsured. Henderson's role suits her because of her past work with City Hall and her connections with officials across New Orleans.
We are in a very, very interesting time in healthcare. We have faced the global pandemic. We have weathered it. We have continued to work during it. And as my CEO always says, that people in healthcare, they never stop working because people's needs are always present. So if you're looking for a job with job security, healthcare is a job with job security because your community is always going to need healthcare. So whatever area you want to work in, you want to work in an area that's secure. So depending on if you're a physician or a provider or even in healthcare administration, as I am, there is always going to be work there to be done. And you can always find something in your actions to do to help people.
Congratulations, Julie Henderson. Dr. Michael Hill, an infectious disease specialist of more than 30 years, has been St. Tammany Health System's go-to person with regard to infection prevention throughout the COVID-19 pandemic. Hill has helped guide the health system's leadership as policies and procedures were developed to keep colleagues and patients safe. Hill also serves on the Advisory Council of Healthier North Shore, a partnership that brings together North Shore leaders in the healthcare, community, civic, and government sectors. Congratulations, Dr. Michael Hill. The Reverend Abina Johnson currently works for University Medical Center New Orleans, where she has led the clinical pastoral education program since 2019. Johnson and her students use an interfaith approach to help hospitals' patients cope with personal struggles and connect with something greater than themselves. In addition to guiding future chaplains through their year-long residencies, Johnson is also responsible for recruiting new pastoral residents. Congratulations, Abina Johnson. Dawn Peavy has faced no shortage of challenges during her career in healthcare. After Hurricane Katrina forced the closure of Charity Hospital, where she had served as a critical care nurse, Peavy transitioned to Oxnard Medical Center, Baton Rouge, to continue nursing. By age 28, she was the hospital's chief nursing officer, and her oversight soon expanded to more than 40 hospitals across the Gulf South. Peavy, who now serves as the CEO of Centers of Excellence and Service Lines of Oxnard Health, has redeployed hundreds of healthcare workers to support critical care units during COVID-19, protecting jobs and ensuring that hospital teams have adequate support.
I decided at a very young age that I wanted to be a nurse. I grew up in a family that had interest in healthcare, although none of them were actually practicing. But I've always been one that wanted to help other people, and so nursing seemed like a great fit around the age of 7 or 8. There's two aspects of my job that I find extremely rewarding. One is getting to interact with patients and being able to witness their recovery as well as the impact that the healthcare system has had on their life in a meaningful way. And secondly is the people that I get to work with every day. Healthcare is a mission-driven, industry, and so there's no other organization or industry in which I feel that people are as passionate about their job as those in healthcare. So they get up every day, come in to try to help people. And I think when you work with a team like that, it's just amazing and very fulfilling.
Congratulations, Dawn Peavy. As director of the UMC Trauma Recovery Clinic and assistant professor of clinical psychiatry for the LSU Health Sciences Center, New Orleans, clinical psychologist Erica Rajo wears many hats. At the heart of her work lies the desire to help people find strength and purpose in the aftermath of trauma. When the COVID-19 pandemic introduced new mental health challenges for healthcare workers, Rajo established virtual psychological first aid groups to help them navigate these unprecedented stressors. She also pioneered Rise Up, a healing space at LSU HSC for BIPOC students, coping with race-based traumatic stress.
Caring for yourself is so important and will make you a better healthcare provider. So the earlier you can start practicing that and really integrate it into your day-to-day, the easier it will be when you are a healthcare provider and you feel like you can't fit it into your schedule. It will already be a regular part of your schedule, and that will then help your patients because you'll have more capacity to show compassion towards them.
Congratulations, Erica Rajo. Chantel Reed currently serves as Deputy Director of the New Orleans Health Department, where she was tasked with handling the response to the COVID-19 pandemic. Reed's previous roles in behavioral health, regulatory compliance, and community services all guided her pandemic response efforts, which included overseeing testing for the city. A native to New Orleans, Reed's grasp of the city's policies, local language, and social determinants of health helped lead her hometown through the public health crisis. Congratulations, Chantel Reed. Lisa Riso began her healthcare career as an aspiring OB/GYN nurse, but quickly fell in love with oncology after doing a rotation in the field. Riso now serves as director of the Slidell Memorial Hospital Regional Cancer Center, where she led a rapid response to the COVID-19 pandemic. Riso continues to seek ways to provide treatment for cancer patients while limiting unnecessary exposure. Currently, her team is planning a program for breast cancer patients that will allow them to see all necessary medical professionals in a single visit.
I entered my career in healthcare when I was 18 years old. I actually started working in a physician's office as a receptionist. I worked in physicians' offices as different things, billing, receptionist. I did dictation. I was 27, decided to go back to nursing school. So I went to nursing school, and when I graduated nursing school, went straight into oncology, found my love for oncology, and I have been in oncology now for 21 years. I've worked different areas of oncology. I have given chemotherapy. I've been a nurse navigator, and now I'm the director at the Cancer Center for the last 2 years.
Congratulations, Lisa Riso. Evelyn Smith's 43-year-long career at Oxner Health has led to her current role as Vice President and Laboratory Services Line Leader, where she led a team to launch the first private COVID-19 testing laboratory in Louisiana. By April 2020, the lab was running more than 3,000 tests daily. It has since expanded its testing capabilities and processed more than 1.2 million rapid tests since opening. Smith is an active member of the American Society of Clinical Pathologists and the Clinical Laboratory Management Association.
When you have a passion for something, opportunities will present themselves across your future career. And knowing what your passion is will never allow you to feel trapped in a job. It's a lifelong learning. It's loving what you do And that enables you to work and learn from others. And as long as you continue to learn and continue to pursue new opportunities, then you will ultimately in life have professional satisfaction. What healthcare enables us to do is to always work as part of a team. And that is, to me, the most rewarding part of healthcare. We all work together to better serve a patient or to better serve our communities as a whole.
Congratulations, Evelyn Smith. Dr. Di Tian attended medical school in China before moving to the United States, where he completed a PhD in neuroscience, a medical residency in pathology, and postdoctoral research in molecular genetics. He is now an associate professor and director of neuropathology services for the Tulane University School of Medicine, where he runs its molecular pathology laboratory. Under Tian's leadership, the lab has administered more than 500,000 COVID-19 tests since the onset of the pandemic, offering rapid test results to members of campus and the larger community. Tian received the Tulane's President's Excellence Award for his work. Congratulations, Di Tian. Dr. Xiaoming Yin is a professor and chairman of the Department of Pathology and Laboratory Medicine at the Tulane University School of Medicine. He joined Tulane just as the COVID-19 pandemic was emerging in the United States. Yin's work helped fast-track a new testing program for the virus, and by April 2020, the lab was providing rapid test results to many members of the New Orleans community. Yin describes his work as turning a crisis into an opportunity.
For the future healthcare professionals, I think if you have not entered into the healthcare professional yet, I would say this field is vast. There are many ways that can be involved, engaged in the healthcare professionals. And I encourage everyone who want to be involved in help the others, particularly in the health professional areas, consider all these different choices and choose the one that fits your talents and your interests the most. And don't believe other people saying that you should do this, do that, but rather just say, this is what I could do, and I'm helping, and I could choose one of the careers. And for that, there's a lot of choices, and you're gonna feel very rewarding.
Congratulations, Xiaoming Yin. Heath Allen has volunteered with the Children's Hospital in New Orleans for 19 years, sharing the gift of music with hospitalized children through the Songs for Kids program. When the COVID-19 pandemic prevented Allen from bedside singing, he created virtual music videos to play on the hospital movie channel. He also performed in a video that was sent to more than 300 volunteers when their work was temporarily suspended. Outside of his volunteer work, Allen is an Emmy Award-winning journalist for WDSU in New Orleans.
The kids in that hospital and children's are so inspiring. Children have complete trust in adults, in their parents, in the doctors. They have no conception of not getting well, and so their spirits are generally up. And with their spirits being up, they buoy the parents. They actually buoy the doctors. The people that come in and volunteer and try to do things with them, they get inspired. It's the children themselves, the ones that are facing the malady, the disease, the cancer. They're the ones that actually inspire you. You wind up getting more out of it than the kids ever did. My dad always told me you don't have to be good, but you do have to be there. And when you're there, you literally become the recipient.
Congratulations, Heath Allen. In her 10 years of volunteering experience, Amanda Foss has provided more than 5,000 hours of service to her local community. Foss's favorite place to volunteer is East Jefferson General Hospital, where her most recent project involved preparing pre-packaged items and serving food to patients and their guests. COVID-19 restrictions temporarily halted Foss's volunteer efforts, but since they've been lifted, she has committed to even more extensive volunteer hours and projects. When she's not volunteering, Foss enjoys spending time with her family and attending church. Congratulations, Amanda Foss.
Congratulations to each of the City Business Healthcare Heroes. They have persevered through challenging times with dedication, determination, and heart to serve our community. They are remarkable, inspirational, and we're very proud to honor them. Now, I'd like to welcome back Lisa to close today's program.
Thank you, Lance. Once again, I would like to thank our partners, Ochsner Health and LCMC Health. The City Business Healthcare Heroes Awards program is possible because of your incredible support. The Healthcare Heroes publication was inserted in City Business on October 22nd and is on neworleanscitybusiness.com. Nominations are open for the 2022 program, so while you're on our website, be sure to nominate deserving candidates. Congratulations to the City Business 2021 Healthcare Heroes, and thank you all for joining us. Be safe and stay healthy.